We're now going to look at adult CPR. Now, adult CPR procedures are the same for healthcare professionals as they are for standard first aid. So the first thing we need to do is make sure that the scene is safe. So to start with, stop, think, act, ensure the scene is safe. Now for point of demonstration here, I'll put the mannequin onto a table so that it's easier to show you the exact skills. But when you actually practice, you may well do this on the floor or being on the table. It's very similar to that in a hospital where you have a bed. Often near the beds you'd have a CPR adjustment for it, so you can just literally hit a button or put a board in, because if you do CPR on a conventional bed, then it's going to be a problem because you're not going to be able to get the depth of compression because the spring's in the mattress. So once we've established that the scene is safe, we now need to see if we can get a response from the person. Now at any point in time you can shout for help, but we do need to find out exactly what's wrong. And if you're in an out of hospital setting, we need to find out the person's not breathing before we then activate the emergency services. So approach them. As you approach, you can introduce yourself. Hi, my name's Keith, I'm a first aider. May I help you? Also, you want to get a direct response from them. Give them a little tap on the collarbone. Hi, are you okay? Can I help you? If you've got no response there, then you can have implied consent to help them. So it's okay to go straight away and help them. So what you can then do is open the airway using the head tilt chin lift. So hand on the forehead and on the bony part of the chin, tilt the head back. And what we're doing here is we're opening up the airway to ensure that if the person is breathing, we can hear and it will clear away the tongue from the back of the throat. Then we want to put that ear down and we're doing a breathing check where we look, listen and feel for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now at that point, 10 seconds have passed. We know the person's not breathing. If we were on our own, we must now activate the emergency services. So your mobile phone, 999 or 112. You can put it on speakerphones. You can continue with the CPR. While you're on the phone, you can be doing compressions. So you're actually giving care while the person's on the phone. But if there's someone else there, you could send them to go and get for help and call emergency services. And also ask them if there's one available to bring an AED over. So once we've done the breathing check, the next thing we need to do is the compressions. So we're using the heel of the hand, interlock the fingers, bring the fingers up, and we're pushing this part down onto the center of the breastbone. So link the hands up, bring the fingers away, because we don't want to be pushing down onto the chest cavity. We want to ensure that these compressions are effective. So in other videos we show about effective CPR, and this is really about ensuring that your whole weight is above, you deliver the compression down and the release, because it's so important to make sure you release the compressions, because if the heart doesn't fill up back up with blood, then you're going to get problems that when you do the next compression, you're only pushing out maybe half of the amount of blood. So with the compressions, we're pushing down 5 to 6 centimeters, and we're doing that at a rate of 100 to 120 compressions a minute, which is roughly 2 compressions every second. So this will look like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Once we've done those 30 compressions, we then come back up, we can open up the airway, and we need to squeeze the nose to seal the nose, otherwise you're going to blow into the mouth and the air will come straight out the nose. Ensure we keep that airway open. Don't go letting go here, because the jaw will just drop down and block the airway again. So squeeze the nose, tilt the head back, and 2 breaths. We give 2 breaths until we see the chest rise, and we don't want to overinflate, so it's just literally those breaths until you see the chest rise. Once we deliver the 2 breaths, straight back over and do another 30 compressions. And then back up, another 2 breaths. And then we carry on 32, 32, 32, and we carry that on until help arrives, until the AED arrives, when we pop the AED on and run through the voice prompts, or until someone else is there to help. And it's a good idea if you swap over every 2 minutes, because you will get tired. And as you get tired, your CPR becomes less efficient. And finally, in this video we've shown you how to do direct mouth-to-mouth resuscitation. But remember, you can use face shields, pocket masks or BVMs to deliver the breaths.